pipes.
Perfect.
Yes, tiny little pipes that conduct milk to the baby. And what happens is sometimes they get clogged with milk, sometimes they get clogged with the skin tissue, sometimes they get clogged with other form of debris. And what happens is that when they get blocked, they allow for bacteria to come and now enter, and then an infection can form from there on. And the infection is basically now what we call mastitis.
Mastitis,
great.
great.
And another thing that can happen when these ducts get blocked is you can get a condition called galactocele, which is basically a small collection of milk in a blocked duct that makes now the duct widen. So you can imagine a pipe that gets blocked and then it starts widening with a collection of milk.
That
so
must be painful.
It is painful. It forms a tender, firm nodule, and now no more milk can flow through that duct. So many times you have milk flowing through the other ducts, but that particular duct, no, and it eventually has to be relieved, and most of the time it has to be relieved surgically.
Oh, wow.
Yeah.
Wow, that is a great deal. Hence, I think the steps into just breastfeeding your child should start from that particular aspect, wear the right bra.
Yes.
Wow, you mentioned mastitis.
Yes.
Could you explain to the people what that is?
Mastitis is an infection of the breast. It can happen to women who are not breastfeeding, but more commonly it happens to those who are breastfeeding. So when breasts get continuously or permanently engorged, ducts get permanently blocked, the milk there remains stagnant. It's not flowing very well. So you can either get a galactocele or you can get an infection. Most of the time we have a bacteria that is prone to infecting the breast called Staphylococcus aureus. It infects the breast. The breast becomes tender, large, swollen, red, very painful, and the flow of milk becomes compromised at that point. Most of the time it happens in one breast. Sometimes it can happen in both. And the way the breast is structured, the breast not only lies on the chest, but also extends into our armpits. So many times the swelling, the redness, and the pain can extend into the armpits and even the upper arm. That's what mastitis is.
Wow, I think, wow, that's really a nice way of explaining, because, I mean, a woman could be having something else, but they don't know whether it's mastitis or not. And so basically the symptoms are the pain around the breast, and all those other things you've mentioned.
And as you're saying, even it's actually quite important to seek medical advice when that happens, because there are many women who even discover that they have breast cancer during the time when they're breastfeeding.
Oh my, that is sad. Wow, okay, so when a mom finds out or they're suspecting that they have mastitis, what's the first thing they should do? Should they discontinue breastfeeding? What should happen?
Okay, so what it would be advisable for a mom to do is see what other symptoms are there, because she may be thinking she has mastitis when she really doesn't. And most of the time it's persistent pain that does not go away even when the baby is breastfeeding. Lots of swelling, the skin becomes very shiny, very tense, very tender, can extend into other parts of the chest and even to the arm. Sometimes she may get fever, she may get chills, and some women even get nausea and vomiting and even develop an infection of the entire body. Symptoms that she should generally look out for. But when that happens, actually it's advisable not to stop breastfeeding during mastitis, because the milk supply has to continue, and also the flow of milk, of breast milk out of the breast needs to continue, because the more stagnation happens, the more the infection proceeds. And then now you're more likely to develop a breast abscess. So easier said than done. Very painful, but women must continue breastfeeding during mastitis. And also it's important to mention that that milk that is infected is not harmful to the baby. So your baby will be safe during that time, and the only time that it's advisable to stop breastfeeding temporarily from that breast is when there's a breast abscess. But whether the breasts are engorged or the ducts are blocked or there's mastitis, we must continue breastfeeding.
Are you mentioning breast abscess? What is that for those who may not have any idea?
So what happens after engorgement and after the ducts are blocked and after you get mastitis, you can develop a condition called a breast abscess. So it's a sequence of events that ends up in the worst case scenario, which is now a breast abscess. It's a small infection. What happens is that there's a collection of tissues that start dying off in the breast and they form pus. And so pus eventually can just stay as a tender nodule in the breast, but sometimes it can even penetrate the skin and start flowing out, which is very painful. It can happen on the side, bottom of the breast. It can even happen around the nipple, but that becomes now a surgical problem, and it needs to be opened. The pus needs to be removed, or drained surgically, and then antibiotics are usually given, and that's now when healing can begin.
Wow, goodness me. You know, we take for granted the fact that we give birth and put a baby on our breasts and it's a done deal. I mean, the more you're talking, the more I'm realizing we have 1,000,001 problems that could possibly occur. And mostly it's because we don't know exactly what to do. We don't understand our bodies. Perhaps our nipples are, you know, standing in a certain manner, which brings us to the next topic, which is about nipples. I remember, you know, I'm small-breasted, and I remember the doctor telling me, you have some very good nipples for the baby. And I'm like, hey, have you seen the size of my breast? But then he's like, no, you have actually very good nipples for the baby to latch on. And so I've heard about inverted nipples and all that. Like, what causes one to have an inverted nipple? What is it?
Okay, so first of all, the size of the breast is really not important. There are women with very large breasts and they develop lactation failure. And then there are women with very tiny breasts and they produce so much milk.
That's me.
So size of the breast doesn't really matter. The nipple does matter because when babies develop latching problems, that's when we get cracked nipples, we get sore nipples. And remember, when the nipple develops a crack or a fissure, that's the place into which bacteria can enter and eventually cause all the diseases we've talked about, like mastitis and breast abscess and so on and so forth. So we need the nipple to remain intact without any cracks. And for it to remain intact, yes, of course, there are some shapes that are preferable to others, but you know, we don't buy them, so we can't have a preferred shape.
It's true.
But an inverted nipple is not a preferred shape because it does predispose women to getting cracks because the baby is not able to latch.
I see.
Some women are just born with inverted nipples.
Yeah.
It just happens. That's how they are. Sometimes
Dr.
it's one,
Christina,
sometimes it's both.
Right. Could you maybe just demonstrate to us by words what an inverted nipple would ideally look like?
So a normal nipple is generally, so you're supposed to have the breast tissue and the tissue around is called the areola, which is the darker part. And then the nipple is actually meant to protrude outwards. And that way it's able to go to the very back of the baby's mouth when they're breastfeeding, which is the ideal position. However, when a nipple is inverted, the nipple itself does not protrude out and it actually goes into the breast. So from the surface of the breast, it just appears rounded. It's not pointed, which is now what we do not prefer because this rounded structure cannot enter the baby's mouth properly, cannot go to the very back of the baby's throat.
Because then that is the right way of breastfeeding, to avoid colic and all these other gas issues.
And even for the breast itself not to crack and to develop other problems.
Wow. All right. So is there anything a mom who is expecting a baby can do, like maybe try to pull the nipples out? Is there a solution to inverted nipples before giving birth?
So we usually prefer to give the solutions after a woman has delivered because if, yes, there are some manual ways to try and correct an inverted nipple, but we prefer women don't do them when they're pregnant because when the breast is stimulated and a woman is pregnant, it produces a hormone called oxytocin. And many times this hormone or chemical can cause women to go into labor. So excessive stimulation of the breast can cause preterm labor. So we prefer women not to fiddle with their breasts when they're still pregnant. But after delivery, what you can do is there are some manual ways to try and make the nipple come out of the breast or evert. These ways have not been medically tested, so they're not medically proven to give us good results. But it is something some women try because, you know, breastfeeding is really influenced by culture, by society. So some women do try that and some women, it does work for them. We do have a device called a nipple everter. It's a small suction device that women attach to their nipple prior to breastfeeding, and they try to suction the nipple out so that the baby is then able to latch. works for some women, doesn't work for others, especially if you have severe inverted nipples. So for women who have that, they are advised to, if the inverter does not work for them, they're advised to try and express breast milk out of that breast either way, so that again we don't go into our sequence of events that ends up with a breast abscess.
Wow. Goodness me, I mean, it never ends.
It doesn't.
Nourishing a child. So I'm going to go to the first question that the audience asked during the week. Yeah? So this lady asked, I have sore and cracked nipples and I have been applying petroleum jelly for 2 weeks now with minimal improvement. What would you advise?
Okay, so cracked nipples, the first thing that causes cracked nipples is a poor latch of a baby. So that is something that she really needs to look into, how her baby is latching. And there are very many different methods of having a baby latch, and she needs to look into that, because when a baby latches poorly, their gums literally destroy the nipple and make it crack, and that's where they can get an infection. So latch, that's the first thing that she needs to do, even if it means maybe asking the help of a lactation expert to show her how to latch, especially if she's a first-time mom. She probably doesn't know how to latch her baby, and correction of the latch can really improve that on its own. However, another thing that I would advise is nipple cream, not just petroleum jelly, but nipple cream that is manufactured to be able to treat a cracked nipple, because petroleum jelly, it's just a general product. It can work for anything.
It's not even safe for the baby, especially a newborn.
It's unknown, to be honest. But the thing is, what you need is a manufactured nipple cream, one that's able to sort out that problem. And the other thing that I would say is important is just to also have a professional have a look at that breast entirely to make sure that there's no other issue with the breast other than just the cracked nipple, because you don't want to find out that maybe you have an infection or mastitis that is now causing the nipple to crack even further. So those are the 3 things I would advise.
All right. And so I'm going to just let you know that Avent has a wonderful nipple cream that is available in all baby shops. Wow, I mean, this is something that I keep saying it's a privilege that not every mother gets to enjoy. And I think here we're going to demystify that guilt of what if I can't breastfeed my baby, because there's so many factors before getting there. But then it's good we have forums like this one, because we tackle this from I'm expecting a baby, what is expected of me, so that when we get to knowing how your nipple looks like, how to latch your baby, how to take care of your cracked nipple, to avoid all these other things we talked about. I mean, this is a wonderful platform, and thank you so much, Dr. Christina, for taking us through that. Now, I want to ask about say infections, and when people are, rather moms are breastfeeding and they have to perhaps take medication, how safe is it? I mean, what to take when they're breastfeeding?
Okay, so there's different kinds of medication. First of all, it's important to say that the medication that women take when they're breastfeeding should be prescribed by a doctor.
Absolutely.
Try not to self-medicate, because you never know what you could be taking. A doctor, preferably a gynecologist, sometimes not necessarily, but it should be from a doctor, because a doctor will know what medication is safe and what is not. We have 2 main categories of medications that we like to look out for when a woman is breastfeeding. So we have the medication that makes milk go away or suppresses lactation, and then we have medication that is not safe for the baby. So it's not going to make the milk go away, but it's just not safe for the baby. So the first kind of medication that suppresses lactation, we have drugs like certain antihypertensive drugs. So if a woman has hypertension after having a baby or even during pregnancy and she's put on certain antihypertensives, they can tend to suppress lactation. There's certain contraceptives, those that contain estrogen, that can suppress lactation. So if a woman goes onto a combined oral contraceptive after her baby, then she should expect her milk to basically disappear. There's other drugs like diuretics, there's drugs that treat breast cancer like tamoxifen. So these drugs will suppress lactation.
Okay.
Now then we have drugs that are not safe for the baby, like certain antibiotics. They will cause diarrhea in the baby, they'll cause gut problems.
Sure.
Some of them cause dental issues later on in the baby. So then basically we have these medications that are just simply not safe for the baby. And when your medication during lactation is prescribed by a doctor, then you're safe from all of that.
Absolutely, because I remember personally I had an infection, actually a chest infection after I gave birth to my baby, and the doctor had to prescribe particular medication. Even during pregnancy, there's some medication you can and cannot take. But I think the bottom line here is, should you feel a bit, you know, unwell or anything, the best thing is to go to an actual doctor so that they can guide you through the safety and to avoid all these problems up ahead. So in that case, yeah, because you've mentioned there's some medication that will suppress the milk, there are other women who just want to stop the milk flow altogether. From a perspective of a professional, do you have particular medication that's meant to do that?
Yes, we do have medication that is meant to stop lactation. And the reason that we give this medication is sometimes a woman has a miscarriage and now she's producing milk. And of course, there's no longer a baby and she wants to stop the lactation, or maybe there's demise of the baby. Some women have to travel away from their babies when they're very young for work and they want to stop the lactation. Some women produce so much milk that even at 2 years, they're completely unable to stop breastfeeding, even though maybe the child doesn't want to breastfeed anymore and they need to stop lactation. So we do have two drugs. Most of the time we like to prescribe a drug called cabergoline and there's another one called bromocriptine. The choice between the drugs is influenced by the medical condition that the woman has at that time, if any. For example, hypertensive women should not take one of those. And the other problem is that cost, of course, is one of them. And the other one is kind of the effect that we expect it to take in the woman. And so we do have drugs that stop lactation, and it's mostly cabergoline and bromocriptine. Okay.
Guys, remember, these are prescribed drugs, and you should always go to your gyna, your, you know, it should be the gynecologist,
it should be the gynecologist,
yes. And they can prescribe that, because sometimes self-medicating can cause other problems that you don't want to cause. And you know, with moms, we get out of that stage of carrying a baby to breastfeeding with all kinds of issues. And this also brings me to thinking, Dr. Christina, like, how would you tackle maybe a woman who is trying to get away from addiction, say alcohol addiction, drug addiction, and breastfeeding? Have you had cases like those, and how do you handle them?
Yes, I have had a few cases like that where a woman is consuming alcohol and she is still breastfeeding. Basically, what we need to inform the woman is that, you know, alcohol is harmful to babies in breast milk. It is. And there are some women who cannot stop at that particular point. So we advise them to either stop breastfeeding, which of course is not the best for the baby, or to be able to, you know, maybe not necessarily give their babies the breast milk at the time that they have consumed alcohol for at least 24 to 36 hours. That is what is safe. The alcohol has terrible effects on babies, including making them sedentary, causing permanent brain damage, and many other problems. But yes, we do have mothers who are unable to stop because they have a problem. They have an addiction. Yes. So that happens. We manage them very carefully. They need to undergo counseling and many other, basically, therapies that involve many professionals, not just the gynecologist or the pediatrician. Absolutely.
Wow, thank you so much. I'm learning so much myself. And we're going to take a short break. Please remember, if you want to be part of this conversation, you can drop us a WhatsApp message on 0797 300 300 or on our social media platforms. Remember, this is brought to you by Philips, who will be giving away some amazing breast pumps in the second session. Keep it right here. Welcome back to the Breastfeeding Open Chat with Ikweza and Phillips. In case you missed the first session, my name is Maureen Waititu and I am with a lovely doctor. Her name is Dr. Christina. Health in women, and let's take it from where we left it off earlier on. Welcome back again to the Breastfeeding Open Chat with Ikweza and Phillips. In case you missed the first session, I am with a lovely doctor. Her name is Dr. Christina Sule, and she's all about reproductive health in women. And earlier on, we covered matters lactation, mastitis, and anything that brings issues when it comes to breastfeeding a child. And so along the way, we were just having a chat, and we were like, sometimes, breastfeeding and a lack of it thereof is mental. It's a
A baby, a newborn, is a very stressful situation. It's stressful on the woman physically, emotionally, it's stressful on her marriage, it's stressful on the people around her.
True.
So it's a stressful situation. And for people to say, just relax, it's so difficult.
Yeah.
And there's many things that, contribute to that stress because, sleep deprivation significantly contributes, lack of hydration, lack of nutrition. Mothers with newborns sometimes don't even have time to shower, leave alone time to relax. And they're told, sleep when your baby is sleeping.
Such
and
a lie.
Sometimes you have anxiety when your baby is sleeping.
Yes.
Sometimes your baby hasn't slept for so long that you're so exhausted to the point that you yourself are unable to fall asleep.
True.
And with high levels of stress, it's and especially if women are genetically predisposed or they have other factors, risk factors for postpartum depression. For example, if they had a very difficult pregnancy and delivery, or if they have inadequate social support, or maybe they have intimate partner violence, then they're more likely to go into postpartum depression. And then postpartum depression significantly affects lactation because it affects the initiation of lactation. So basically, how soon a woman starts breastfeeding is affected by postpartum depression, how frequently she feeds her baby, even how she latches, because the latching part takes a lot of patience. And with postpartum depression, women don't have that kind of patience. They're unable to, patiently go through breastfeeding. It also affects the number of feeds because many times the woman may be depressed, may be asleep, may be doing other things and may not feed her baby as frequently as she would. There are times maybe, she's going through a panic episode or crying, and so she doesn't have time to breastfeed at that point. And it also affects the duration of how a baby is fed, not only per feed, but also how early she discontinues breastfeeding. So women who have postpartum depression are likely to discontinue feeding their babies earlier than women who do not.
Wow.
So it really does affect breastfeeding significantly. And aside from social support, these are women who, if it's severe, probably require to see a psychiatrist. Some of them require to be on medication. And their social support is not just to support them in and they may need to be separated briefly.
Wow.
So it does affect lactation significantly.
Wow, that's great, because I mean, I had questions which you've already answered of what steps a mom should take, or how they if they realize they could be suffering from postpartum depression or baby blues or just normal stress to a point of the extremity, and their social support. Maybe just recap for us what people around a new mom can do for her.
So most of the time, women with postpartum depression do not realize that they're maybe neglecting their baby, or they just feel like they're stressed. And then the people around them like to tell them, oh, it's blues, or you'll handle it, or you're a first-time mom. And many times it goes beyond that. So people around a new mom should basically see how she's interacting with her baby, how heavily the situation is weighing upon her. Is this someone who looks like she can harm a baby, or is this someone who is just slightly overwhelmed and maybe with a little bit of help, physical help I mean, and social support can actually, you know, come out of it. So it's about the people around her to judge. There are no typical symptoms of postpartum depression. So it's for people also to judge and see, okay, this interaction is normal. Here she's trying, here there's a gap, here we can fill in, maybe we can do some housework, maybe we can hold the baby for a while, and then, you know, such things improve. And then there's some who will obviously see, no, this is someone who is harmful to the baby, and let's really keep a very close eye, because postpartum depression gets worse sometimes when the mother is completely separated from the baby. So it's a very delicate balance.
Wow, goodness me. I mean, I'm so proud of every woman who is actually recognizing, because some of these things also come with a lot of stigma, whereby, can you imagine someone whispering, she gave birth to a baby, but she doesn't want to touch that baby. But in reality, you don't know that this mom is really, really suffering. Struggling. And so personally, I would encourage everyone to just take that mom, especially the first 7 days. I know there's that aspect of baby blues, whereby there's this new creature in your life, especially for first-time moms, and all kinds of things happen with a newborn. They could be suffering from jaundice. Like I remember with my firstborn, he had jaundice on the 4th day, and we had to be readmitted to the hospital. And I was losing my mind. I was crying so much. And unfortunately, I slipped into severe postpartum depression. But this is the irony. The people around me didn't know. They thought I was just acting up because I was keeping the doors closed all the time, the curtains closed. I couldn't leave the room. I powered through it, but I learned about it later. So I think less judgment, more knowledge, and more love to new moms, especially because once the mom gets that support, they support the baby, and everybody is healthy.
I agree completely.
Wow, so we are going to go to questions that, again, our audience have been asking, And so I will start with this lady who's asking, I stopped breastfeeding 3 years ago, but every time I press, breast milk comes out. What would you tell her?
So it's quite normal for women who have ever breastfed to produce milk even after they stop breastfeeding. It's something that can be initiated, especially if you press the breast or stimulate it in any way. You can actually start milk production. Doesn't happen in all women, but it does happen in some. One thing that I'd like to caution, though, is that there are those women who produce milk or have a milky discharge, and that could be a medical issue. So when women have high levels of a hormone called prolactin, which is the hormone that is supposed to facilitate breastfeeding, then they can be producing milk even outside the breastfeeding period. And excessive production of prolactin can happen on its own, or it can happen because of certain tumors in the brain, because prolactin is a hormone produced in the brain. And so when you have certain kinds of tumors, they're called prolactinomas, they can tend to cause a lot of production of prolactin, which means that now you start producing milk even outside the breastfeeding period. So it's something that a woman would need to see a medical professional about. And if they rule it out, then they realize everything is fine and it's just excessive milk production.
Absolutely. And I think what I've been getting from this conversation, Dr. Christina, is that should you suspect something that doesn't look normal, it doesn't hurt to just walk into the doctor's office. You could rule out so many underlying, problems and early enough. Great. So another mom is asking that I am 5 months pregnant and still breastfeeding my 11-month-old baby. When should I stop breastfeeding him?
So it's safe to breastfeed babies even when you're pregnant. Pregnancy should not stop you from breastfeeding if it's actually what you want. Some moms prefer to stop, but really, medically speaking, there's no need to stop breastfeeding even if you are pregnant. You can continue breastfeeding completely. It becomes a challenge when the second baby comes along, and now that's the baby that needs the actual breast milk. And then this one is older and is already feeding, has probably been weaned, you know, can take cow's milk and other kind of milk. So at that time, then it's best to give the newborn priority. However, when you're pregnant, it's safe to breastfeed throughout pregnancy.
Wow, must be a delicate balance trying to pull this, because that's a little baby, 11 months. But I guess mom, keep breastfeeding your babies. If the other one comes, even better, you'll have gotten used. Maybe she'll skip the the latching, you know?
Issues.
Right. Now, another mom is saying that my nipples are too small. Latching has become difficult. Please advise, what should I do?
Honestly, for that, I would say keep trying, because the main challenge that I'm guessing she's facing is getting the nipple to go all the way to the back of the throat of the baby. And if you generally have small nipples, that can be a bit of a challenge. Most of the time, women think their babies are not getting enough when they actually are getting enough. Big nipples, small nipples, or otherwise. So what she should look out for is that the baby is producing enough stool, so has enough bowel movements, that the baby has diaper changes up to 6 times in a day, most of the time for a newborn. That they don't look, you know, dehydrated, which might be difficult for a new mom to tell, but ideally they shouldn't be dehydrated. So there are lots of bowel movements, lots of diaper changes for pee, and then also that the baby is consistently gaining weight, because many times you just feel like your nipples are small, but your baby is getting enough milk and they don't really care about the size of your nipples. So it's a problem when your baby is not getting enough milk, and for that I would say involve a lactation expert, have them come over, ensure that your baby is actually breastfeeding, getting enough during each feed, and then most of the time the size of the nipple doesn't really matter.
It doesn't really matter as long as you
as
get
long as
to latch.
Enough is happening.
Enough is happening and the baby takes it all in, because the nipple is just what it is. It's a nipple. There's the rest of the breast, and I know the idea is to get the nipple
areola,
as far back into the baby's mouth as possible. So mama, put it all in and the baby will be fine. And don't panic, just check the weight and check with the pediatrician, and also don't panic, it might affect your breastfeeding. Wow, another mom is saying, I have a lump near my breast and I'm due in December. The lump is not painful. Should I be worried?
I don't like people to worry.
Yes.
However, if you have a breast lump, whether you're pregnant or not, that is definitely something that your gynecologist should attend to. They may ask to do an ultrasound, because there are very many women who discover breast cancer during pregnancy and during breastfeeding. It's worst case scenario. I don't like to cause people to fear into, you know, rather go to a specialist because of fear, but it is something that they actually need to attend to and to have a look at. Cancerous lumps are not always painful, and that's the reason why she needs to have it checked by a gynecologist or a breast surgeon. Wow.
I mean, again, see your doctor, and I'm sure she says she's due in December, so that's another couple of months to go. Always mention that to your gynecologist when you're seeing them. It's better to be safe than sorry. And again, it could just be a lump, so no need to panic. I think we discussed this, but maybe we can discuss this in details, whereby a mom asked, do contraceptives affect breastfeeding?
Certain contraceptives do affect breastfeeding. So the contraceptives we prefer to give during breastfeeding are the progesterone-based contraceptives. So progesterone does not affect breastfeeding, and that can be either a progesterone-only pill, which a woman takes every single day, does not affect breastfeeding in any way or form. It could be a progesterone injection, either 2 or 3 monthly injection, again does not affect breastfeeding at all. It could be an intrauterine contraceptive device, either copper or progesterone-based. progesterone releasing intrauterine contraceptive device, again, does not affect breastfeeding. However, we do have contraception such as combined oral contraceptive pills, and these are daily pills that have both estrogen and progesterone. Now, these pills do affect breastfeeding, and they can make the supply of milk, breast milk, go significantly down or disappear completely, which again brings me back to the fact that if you want to go on to contraception, usually we advise women to go on contraception from 6 weeks after delivery or later, but usually from 6 weeks after delivery. It's preferable that it's prescribed by a gynecologist.
Absolutely.
Just because your friend is taking a pill, she may not be pregnant or breastfeeding. You are breastfeeding, so if your gynecologist prescribes it, then they take full responsibility for what they have prescribed to you and its effect.
Absolutely. And I think what I'm also getting from this is a lot of women like following what the other woman is doing without thinking twice, especially when it comes to contraceptives. I have been there, and I'm asking my friends, so what do you use? You know, should I use the same thing? Until I made my own decision and I put the contraceptive I put, and it's been working for me. And what works for me may not work for another mom. Right. So another lady asked, I feel pain when baby is breastfeeding on the other breast, then it has a crazy letdown. If baby is on the right,
please repeat that.
Sorry, she says she feels pain when baby is breastfeeding on one breast and the other one has a really crazy letdown. If the baby is on the right breast, left breast will be painful. What can be the problem? I even stopped pumping, but it won't go away.
Okay, what I think could be the problem, just off the top of my head, because I haven't seen her or examined her, many times when women breastfeed on one breast, the other breast also has a letdown. That's a normal response, because when breastfeeding is initiated, a lot of oxytocin is produced, and it's the hormone that is responsible for milk letdown. So it's quite common for the other breast to start leaking or even just producing a lot of milk. My advice to moms is usually don't waste that milk. Please find a way of capturing it, either through a breast pump or in any other way. But it's still advisable for a baby to completely breastfeed from one breast until it is empty before transferring to the other, because the shifting back and forth isn't really good for the baby and even for the routine of breastfeeding. Now, during the time when a baby is breastfeeding on one breast, the other breast could be paining because it's getting full. All the ducts are getting full because oxytocin is being produced. Now, when the baby is moved to that particular breast, the baby is relieving that pain by emptying that breast, and so the other breast can start paining. I think that's a normal thing, especially if it's not causing engorgement, swelling, fever, and the baby is happy and gaining weight. I wouldn't worry too much about it. One thing I would advise is probably taking a painkiller for some time and seeing how it works, because women who have severe engorgement tend to be quite relieved by certain painkillers. And I think with time it should resolve.
Then again, prescribed.
Prescribed, of course. Prescribed, of course.
Right, that's a very good point, because I remember when I was breastfeeding my youngest, when he's on this side, I would pump the other side, and everything, you know, it's such a nice natural letdown when the baby latches, and it's not always pleasant. It can be very painful. So mama, if again, look out for things like fever, anything that is out of control. Look at how the baby is responding, but otherwise you shouldn't worry about it, especially for the newer moms, when the milk is just coming, you know, the first 3 months, right? So our last question is coming from another mom who is saying that I keep getting recurrent mastitis. My son is now 21 months old. What could be the problem?
Again, it's difficult for me to say what could be the problem. It could be certain challenges that she faced during breastfeeding. Maybe the mastitis started during breastfeeding, and I don't know whether she's still breastfeeding her 21-month-old son or not. But if she has discontinued breastfeeding, there are some women who get mastitis even when they are not breastfeeding. I would definitely say to see a breast surgeon or a gynecologist. Many times they'll want to do an ultrasound just to rule out anything else, just to ensure that it's truly mastitis and not anything else.
Absolutely.
And then if it's mastitis, it could be treated with an antibiotic. Many times we even take a sample of the milk that's being produced. We have a look at it under a microscope. We culture it to see which bacteria are sensitive to a particular antibiotic that can be prescribed to that patient, because sometimes you might be given an antibiotic by a doctor that is not, the bacteria are not sensitive to that particular antibiotic.
Absolutely.
So when we take a culture of that milk or whatever is coming out, whether it's pus or milk, then we're able to prescribe the correct antibiotic so that the mastitis can resolve once and for all.
Wow.
Yeah.
Again, see your doctor. So going to take another question. Could you give us a general overview on breastfeeding hygiene? What are the steps? The minute the baby comes out, you're already breastfeeding. What are maybe the 1, 2, 3 steps a mom should take, first starting with the right bra?
Okay, so yes, of course, there's the right bra.
Yes.
One of the things that I would say is to start breastfeeding immediately, as soon as possible.
Yes.
That's always not possible for some moms. For example, if you've had a cesarean section and now you're recovering after the cesarean section, within even the first hour of having a cesarean section, it's not always possible to attach the baby immediately, or maybe you had a complicated surgery and now you're not able to attach to your baby immediately. But if you've had a normal delivery with no complications, I would suggest to initiate lactation as soon as possible.
Yes.
The other thing is I would suggest, frequent feeds, feeding the baby on demand. Now, what I would suggest, especially for those who are starting to experience cracked nipples and so on and so forth, is of course the nipple cream, a commercially manufactured one that is specifically for cracked nipples and nothing else.
Yes.
And then I would also, some experts suggest applying the actual breast milk on the breast and on the nipple, the one that is specifically affected. And then in between feeds, it's best to keep nipples dry and aerated. Easier said than done. Of course, nobody wants to
walk around with nipples.
Yes, but it's best to keep them dry and that's air dry, because the more moisture they accumulate, the more likely they are to get cracked or to get infected.
Absolutely.
And then just to wash the breast regularly, once or twice a day whenever showering, with whatever soap, and ensure that it's completely rinsed out.
Yes. Yeah, because you don't want to introduce
some
harsh chemicals
to the baby.
Exactly. So I think that also makes a mom, I mean, I think it's advisable for moms to even use more natural, soaps and products, right?
Yes, yeah.
If not, just rinse well.
Yes. What I would discourage is frequent washing or washing every time before a feed. That is not necessary.
Okay.
Yeah.
Wow, that's a very good point. So the last question is concerning something very new in the world. And there's a mom asking, should I breastfeed if I am COVID-19 positive?
Wow, yeah, that is an interesting question, and it keeps popping up a lot. I would say yes. Yes, breastfeed if you are COVID positive, but take all the necessary precautions. So wear a face mask, in fact, double mask if possible, wear a shield, try and latch your baby, but try, face away from your baby if you can. If you must cough, try and, be as far away from your baby as possible. Cover your face, use your hand, your elbow. But yes, breastfeed as frequently as possible, because if all the necessary measures are taken, sanitization, double masking, a face shield, then the baby should be able to breastfeed comfortably without contracting. Of course, within 2 weeks, test again, see whether you're negative. Watch out for all the symptoms, cough, fever, all the symptoms that have been described. If you develop any of them, be attended to in a medical facility. However, being COVID-19 positive is not a reason to stop breastfeeding. As long as all the measures are taken.
All of them are taken. Okay, wow, that is quite amazing hope, especially for moms maybe with newborns, moms who have kids who can't live without breast milk.